Uh, all right. Hello. Welcome to OBHealthy. This is Physicians Health Network, and we're a group of Black physicians, and we're here to improve the health of people that are from African descent. Also, we're here to encourage young Black men to go into medicine. Understand that our webinar is every second Saturday at 1 o'clock Eastern Time. So please join us and have others join us as well, okay? Prior webinars can be viewed on YouTube. So you can go to OBHealthy on YouTube and see all of our prior webinars. Remember to subscribe when you go to YouTube as well. The most important thing that I can say today is please do not change any aspect of your medical care, no matter what we say, until you consult your physician. Right now, I would like to introduce the doctors. We're going to start with Dr. Ernest Rogers, and he's our special guest today. Dr. Rogers, please, can you introduce yourself?
Thank you, Dr. Bay. Yes, I'm a veterinarian here in Maplewood. I treat dogs and cats, horses and snakes, and that's a little bit different than the other doctors. I completed my medical degree at Tuskegee University and have come from Virginia Tech to set up residence here in New Jersey.
Well, thank you very much. And we look forward to all of the questions that'll come through and the answers that you'll give. Dr. Court, can you please introduce yourself?
Good afternoon. My name is Dr. James Court, a graduate of Howard University Medical School. I practice in East Orange, New Jersey, specialty internal medicine.
Thank you very much. Dr. Atherley, please.
My name is Trevor Atherley. I'm a cardiologist practicing predominantly in the Essex County area. I'm based at Newark Beth Israel Medical Center. I practice all manner of cardiology, interventional, non-invasive, and clinical. And one of the major interests I have is in teaching the cardiology fellows whom we train in our program.
Thank you very much.
Good
Dr. Salam.
My name is Dr. Kareem Latif Salam. Good afternoon, everyone. I'm a board certified adult and child and adolescent psychiatrist. I work in the city of brotherly love and sisterly affection, known as Philadelphia. I'm the medical director of an adolescent unit, so I only treat inpatients. I'm on the faculty of Drexel University College of Medicine, and I'm a founding member of Global Health Psychiatry. We publish mental health literature targeting the Black community. We've published 3 books in 3 years, and I'm so excited to be here. Thank you so much for the opportunity.
All righty, thank you. Dr. Patrick Anderson, welcome.
Thanks, guys. Happy to be here. I'm Patrick Anderson. I'm a board-certified gynecologic oncologist. I treat women's cancers. I'm chief of gynecologic oncology at Newark Beth Israel Medical Center in Newark, where I practice and collaborate with this honored group. Glad to be here.
All righty, excellent. And I'm Dr. Omar Bey. I'm a pulmonary critical care physician with a subspecialty in nutrition, and I am the host. And so glad that all these esteemed doctors were able to join us today, and we're ready for some questions. Also, I would like to thank OBHealthy for allowing us to use their platform to bring this webinar to you. All right, so let's get started. You know, Dr. Rogers, we're going to start with our specialty topic, and that's veterinary medicine. You know, first question I would like to ask is, and we understand COVID is a problem that's throughout the world now, as far as humans are concerned, but can our pets catch COVID? And what do we need to do as far as that's keeping them safe? Can you start off with that?
Okay, well, let me start off by saying my PhD is in infectious respiratory disease, particularly looking at bacterial diseases, but the principles are the same. Animals can be tested positive for COVID, but all the animals that I've read or researched about have been tested positive as a result of being in close contact with another infected human being, not that they've developed the disease themselves. All evidence to date from the CDC and other learned institutions suggests that no, COVID cannot be presented to a human or passed on to a human. So in terms of COVID, the most likely pets that are going to have exposure to COVID are the ones that may test positive. Very, very unlikely that an animal will test positive without having been exposed to someone who is already COVID positive. So the takeaway message here is don't hug your dog when you know you're positive. Don't kiss your dog. Don't have your dog sleep in bed. That will go the same for cats or any other pets. Try and avoid contact with the pets as you would with your fellow human beings in the house.
Excellent, excellent. All righty. You know, the thing of it is that in most households, the pets are, you know, they're so important. They're so important if you have children. They're so important to us adults as well. And, you know, as far as pets and decreasing stress, that's another thing. And I know, Dr. Salam, you're going to chime in on this, but can Dr. Rogers, can you at least start off with how pets decrease stress for us, you know, us adults that work 24/7?
Well, I can give you an example of how pets help humans. Back in '88, when I was in school, I was at Tuskegee, as I said, and we made trips to the Tuskegee Veterans Hospital. There was a patient there who wouldn't talk. He hadn't talked in 20 years. My dog was a therapy dog, and I brought him in, and the dog went up to the person. The person pet him, but didn't make any response. Someone put a cat on the table, and the first thing this man said in 20 years was, "Here, kitty, kitty." That tells you that there's a human-animal bond is well known, well respected, and occurs throughout the world. It's not just in North America. However, in terms of having a pet that can help you through stressful times, people talk to their pets. People pet their pets. People feel the comfort of unconditional love from their pets. And as a result, your stress, and I think Dr. Salam can speak to this, stress increases your oxytocin, decreases your blood pressure, increases your awareness of people around you.
Okay.
So I think Dr. Rogers froze, but to chime in, another thing that's useful, particularly about dogs, is that they force you to get exercise, right? They have to be walked several times a day. So your body, your skin is exposed to sunshine and fresh air, and you get the vitamin D production in your skin, and it forces you to move, right? That has cardiovascular benefits. You mentioned the increase in oxytocin, the decrease in cortisol, which is a stress hormone. Pet owners tend to live longer. They tend to be happier. And in addition to all of those benefits, pets are really excellent models for mindfulness, particularly dogs. So being present in the moment, being observant, being aware of your emotions in the moment, and really pets have a fierce loyalty to their owners. So most of the literature in support of the therapeutic benefits of pets and animals has been done on dogs, cats, and horses. But pets have been very effective for youngsters who struggle with different mental health conditions, whether it be anxiety, ADHD, attention deficit hyperactivity disorder, kids who have difficulty socializing and who have difficulty with interpersonal interactions, kids who are on the autism spectrum. So there are a variety of conditions for which pets could be very useful in terms of just relaxing the individual, imparting therapeutic benefits on them, and then, you know, the simple act of getting out into the world and engaging during dog walks. And it's also a nice conversation piece and a useful way to connect with other pet owners.
Yeah, yeah.
If I can just chime in,
Mhm.
there's one benefit that unfortunately we must make our people and clients aware of, and that is that when a pet dies, it's tearing the heart out of most adults. It certainly affects many children, but I think this is often their first introduction to death. And we need to have our parents and our caregivers help these children work through the anxiety, and I don't know who believes in Elizabeth Kubler-Ross anymore, but work through the stages of dealing with death so that the stages are appropriately founded and appropriately addressed, so the person, usually the child, can work through them properly and not develop bad sociological problems as a result of death. So if they can work through it with a pet, when grandma or auntie or uncle or God forbid mom or dad dies, they have a basis on which to look to develop a better attitude and a better psychology to deal with death.
Yeah, that's so important. That's so important. Dr. Salam, as far as dealing with death, I know that in the ICU, from a medical standpoint, we understand it for physicians and nurses and stuff like that. But I think especially in the African-American community, there are different ways that we deal. But I think looking back and how our families, so many families are broken at this particular point, when we had a strong family support, you could deal with it better. Can you tell us a little bit about that? And from there, we're going to go to some questions on COVID that's coming through from the audience. Go ahead.
Certainly. So thinking in terms of death and grief and loss, you really want to have a conversation with folks, and you don't want to hide behind medical jargon. You want to speak in straightforward language. And we all have ways and mechanisms by which we cope. So for some of the, and we want to use more adaptive and beneficial ways of coping. So we want to avoid things like substances, like excessive use of alcohol or illicit substances. We want to think about and reflect on the life of the lost loved one or the lost pet, the positive memories that we've had of them, and really celebrate those anniversaries and milestones. So you'll often see on social media, folks celebrating birthdays of deceased loved ones. And you should really focus on someone's emotional state as it applies to the death over time. So naturally, when you first learn about the death, it's a shock. You know, you may have emotional numbing. You may feel like, what happened? Where am I? And then the intense grief could set in, and the sadness and really the loss that could lead to some temporary impairment in functioning. However, over time, the intensity of the loss should diminish. So not the emotional intensity of the loss should diminish, and it should allow you to function. So carrying out your social obligations, going to work, school, things like that. If the loss is as intense 6 months to 1 year from the time of the event, that's actually problematic. And if it's interfering with your ability to go to work, to go to school, to maintain your social relationships over time, then it may suggest you need to get professional help. So those are things to be mindful of and aware of. And again, finally, over time, you should have more comfort remembering the lost loved one in a very positive way, as opposed to continuing to grieve them. And naturally, during periods like holidays, anniversaries, that grief is going to be more intense, and you may carve out the time to reflect a little more deeply on those specific anniversary markers.
Mm-hmm. And that's same for humans and pets, right?
Absolutely, yes. Pets are for many of us, our pets are part of our family. And I remember hearing a common phrase that said, people will spend to the end for their children and their pets. So.
And
Question for Dr. Rogers, it's Dr. Anderson. How do you prepare a child for the introduction of a pet? When a child comes to you and says, Dad, I want to get a dog. How do you prepare a child for the responsibility to properly care for a pet?
Well, I don't think you can prepare the child. You have to prepare the adult. As in many cases, children want pets, but most children, say even under the age of 15, are unlikely to be responsible enough to take care of the pet. To bring it to me for its vaccinations, getting neutered, sickness and in health. So you really have to prepare the adult. That's the first part of what you have to do. Once the adult has decided that they're going to take responsibility for the pet, then I think we have to prepare the children after that and have the children understand what their responsibility is to the pet, and to understand that pet is an animal, not a toy. You can't injure it, you can't play with it, you can't, you have to treat it with respect as another family member would, although not a family member that's going to talk to you. And I think once the parents are willing to take responsibility for the pet, and once a child or children understand their responsibilities to both the parents and the pets, I think then the next issue is to choose the proper dog for the family. In my opinion, there are breeds of dogs that, though they might be good with adults, are not good with children. And so the child and the adult have to make a decision as to how much care they want to give the animal. Certainly, I have a husky, and she's a lot of work, a lot more work than many other breeds. So the amount of work you're going to put into grooming them, to maintaining their dental health, to maintaining their physical health, to give them exercise. As Dr. Salam pointed out, giving an animal exercise is all fine and dandy, but if you get a German Shepherd who needs...
Lost Dr. Rogers there. Yeah, I'm not sure why we lost his audio. We lost your audio, Dr. Rogers, for some reason. I'm not sure. Can you check it out? Yeah, we're going to check on his audio and we will continue with that. All righty. Dr. Rogers, we're coming to your rescue.
Okay.
Oh, there we are. We're back. I don't know what happened. All of a sudden, we lost your audio. Somebody snatched it from you.
That's been happening off and on since I've been here. But
all right.
Yeah, I think we have to, and the three big points are: one, prepare the parents, because they're the ones that are going to have to take care of the animal in the end. Prepare the children for their responsibilities, and then match the proper pet with the proper household.
Dr. Rogers, before your audio went out, you were making a point about taking an animal out for exercise, and you mentioned a German Shepherd. If you could complete that point.
It wasn't so much about a German Shepherd, but many large dogs, including German Shepherds, which I've had several, require a high amount of energy and high energetic exercise. So I guess my point was that if you're a 70-year-old man who can barely walk, even though you might want a German Shepherd, you're going to have behavioral problems if the animal, whether it's a German Shepherd or a husky or any other animal that requires high energy, if it isn't getting its exercise, it will lead to behavioral problems, what some people call zoomies, where the dog who doesn't get enough exercise, or even the cat doesn't get enough exercise, will run through the house, knocking things over and having a good old time just going around. So I think the point I was trying to make is you have to match the pet, the appropriate pet, to the owner based on the grooming needs, the exercise needs, the medical needs. We have certain dogs that come into the clinic, and I just look at the owners and I say, you know, this was a gift from God because they have so many medical problems. So people have to be aware of what they're getting into before they purchase or find a dog.
Dr. Rogers, Dr. Court. On. I have a problem. Recently I was exposed to a cat that we have at home. Previously, I had no problems with the dog. We bonded. How different it is to bond with a cat. What should I do in order for the cat to become my friend, as the dog was?
It'll really depend on the age of the cat, where the cat came from. Feral cats tend not to be as cooperative with humans as cats that you have had since they were a kitten, and you groomed them and you took care of them. Cats are not pack animals. Dogs are pack animals, so it's much easier to interact with most dogs on a level because they consider you part of their pack. I've been very fortunate, and all my cats have been very affectionate to me, and they will actually come up to me and want to be pet. If this is an older cat that hasn't wanted that, you're basically starting from trying to discipline a teenager, and we all know that can be difficult. So certainly there are things that we can discuss to help you, but there's nothing specific I can give you without having an examination or at least getting more information about the pet.
Excellent answer. Yeah, I have to remember to take myself off of mute. Let's do this. Let me go to some of the questions because they're coming in. Here's one question from an anonymous attendee. Can people take animal medicine or for COVID-19? For example, animal is this, I'm not familiar with this one, ivermectin?
Ivermectin.
Ivermectin.
Ivermectin, I'm not familiar with it. Go ahead, Dr. Rogers.
Ivermectin is an anti-parasite drug used in horses, dogs, and cats. I've talked to another doctor about this who felt it was the appropriate thing to do. In all research that I've read, and in my opinion, having my PhD and looking at all kinds of pharmaceuticals, I would say no. No one should take any form of animal drugs. It's just the doses are different, the prescription is different, the excipients or the added ingredients are different than any human drug. So yes, there is ivermectin out there for physicians to use, but it's not the one that's used for animals. That's number one. Number two, I think many of the drugs that we use, unlike physicians, veterinarians can prescribe any drug, including human drugs. We prescribe Viagra for animals with pulmonary issues. So we can prescribe any drug, but the other way around is not true. I don't recommend anyone ever take any antibiotic, any pulmonary drugs, any other drugs, especially antiparasitologicals or antiparasite drugs like ivermectin at any time without specifically talking to their physician and getting the appropriate drug from their physician.
Thank you very much. And I think that was so important the way you explained that, because as you know, in the news, there are some people that are giving that a try. And I think it's, we thank you for explaining that. Dr. Court, go ahead.
I was just saying that as far as I know, ivermectin is to treat parasites. And there's no connection that I know of between COVID and any parasitic infections or something. I couldn't see the relationship between the two.
Right, right.
Well, Dr. Court, you're exactly right. However, there have been some studies done in Europe that suggest that it's an anti-inflammatory as well in humans. I don't believe that's true based on my studies.
Okay, for some reason, we're having problems with audio again with Dr. Rogers. We will try to solve that problem as we go forward. All righty.
I keep cutting out.
Are you back, Dr. Rogers?
I am back.
All right, good. I don't know why we're having problems with the audio, but we're trying to solve it, and we'll get that under control. There's another question that came. The questions are coming through. Let's see if we can answer some of these. Dr. Rogers, my rescue dog suffers from extreme separation anxiety, even after living with us for 2 years. How do we best help him get past this?
Well, I'm happy to address that issue. There are people, and I think I should point out at this point, all veterinarians or most veterinarians are general practitioners. A few of us have specialties. My specialty happens to be forensic medicine, but there are veterinarians who are specialized in behavioral medicine, and they will use drugs to retrain the dog. They'll use trainers to help retrain the dog. Separation anxiety is a horrible effect on an animal. Animals tend to destroy things. So realistically, I think I would refer you to a veterinary behaviorist. You can find them through your regular veterinarian, but separation anxiety is something that happens when a dog feels it's being abandoned again. Many dogs that have been adopted and returned and adopted and returned and adopted and returned, once the owner leaves the house, the owner or the patient, the dog, feels, well, that's it, I'm going to be returned again. I don't want to go back to that place. So that's part of the issue. There are a number of other issues that can be addressed with behavioral interventions, and actually even some interventions the owner can do, but it's not something that we can get into for every dog. But those are some of the issues that can be addressed by a veterinary behaviorist.
Dr. Rogers, if I may ask, this is Trevor Atherley, cardiologist. Are there any diseases that we have to be concerned about that would be contagious or affect human beings if our pets have them?
Yes, yes. Appropriately asked question. Many diseases are zoonotic or contagious either from people to animals or from animals to people. And one of the big ones that I really worry about are fecal parasites, things like roundworms, hookworms, and whipworms. Also tapeworms. Some external parasites like fleas and ticks can be brought into the house by a pet who goes outside. But roundworms, hookworms, and whipworms are particularly of concern to children under the age of, say, 10 or 15, where their hygiene habits are not very good. And that's a problem, because hookworm or roundworms in particular in a young child can lead to mental retardation, liver disease, blindness. And so we have to be aware that that's one of the zoonotic diseases that can happen. I try and get every single one of my patients that come in for vaccination to do a fecal. And that's where we take the poop, the dog poop, we send it to a lab and they look for the eggs. And if the poop comes back positive, then we treat the patient, the dog or cat, for the disease that we see or for the intestinal parasites that we see. Other diseases that can be transmitted are things like leptospirosis, ringworm. Leptospirosis doesn't actually come from the animal, but comes from the animal eating or consuming in some way either rat or mouse feces and urine. And that's something that once they have it, some animals, dogs in particular, can be excretors. And when a dog pees in a certain spot and a person gets into leptospirosis or into the organism that causes leptospirosis, they can then absorb it themselves. But I want to make aware that things like feline leukemia and feline AIDS have not been shown to be transmitted to humans. So I tell someone that their cat has AIDS and they're worried for themselves, and it's very unlikely that they're going to get it.
Dr. Rogers, Dr. Anderson, I have two questions. The first have to do with parallels. So in certain households where you have multiple children, there is the concept of sibling rivalry. In a household with multiple pets, is there such an issue? And then the second question is, from a primary care perspective, is there maintenance protocol that you recommend for someone with a certain pets, different types of pets, and pets of certain ages?
With respect to the first question, yes, you can have sibling rivalry among pets. Of course, again, that's a behavioral issue. And to address that issue, it's how you introduce the new pet to the old pet. I've been in several situations where I had two cats and they would sleep together and groom each other and wander around the house with each other. And we got a third cat. One of my cats would go up to the bathroom, and this third cat actually was paraplegic and was unable to control its bowels. So we tried to keep him in a contained area, which would be the bathroom with the door. My one cat would go up to the door, open the door, and let the other cat come out, and they would pee and poop all over the house. So there was some kind of connection there, even though the second cat came in years after the first cat. In terms of dogs, as I said, dogs tend to be pack animals and they tend to do well together. But that doesn't mean they always do well together. So again, this is an issue where how you introduce the animal, the type of animal you get, and how the adults respond to the animal is very important. On that note, new babies can cause a lot of problems in a house. A dog that has been the only dog in the house, and now all of a sudden parents come home with a new baby and are obviously spending by far the majority of their time with the baby, that causes jealousy among animals. Some animals, no problem whatsoever. Other animals may think the baby is a toy, or even worse, they think the animal is a prey, or the baby is a prey. And that's simply because babies don't smell like adult people. They don't sound like adult people. They don't act like adult people. So why couldn't it be a rabbit? So that's another aspect to multi-organism houses or multi-person houses. So I hope that answers your question. With respect to the second question about maintenance of pets, I always recommend pets between the ages of puppyhood and say 8 or 9 years old, always get to the veterinarian once a year. Any problems that we see in a pet, not that we have a crystal ball, but we do the same physical exam you do. We listen to the heart, we listen to the lungs, we palpate the abdomen, we check the perianal region, we check the teeth. All animals have the same maintenance requirements as humans. The one place that we have fallen back as veterinarians is doing the teeth, is dental prophylaxis. And we know that as humans, we brush our teeth twice a day, we floss twice a week, and we still have to see our dentist twice a year for a cleaning. Many animals have not had that opportunity. And I think one of the things we worry about is septicemia, we worry about tooth loss, we worry about cardiac effects of poor dental hygiene. And so that's part of the exam that the owners really can't do. The second aspect is vaccination. Just like we're doing for COVID, we think that vaccination prevents a lot of diseases. Obviously, one has to avoid exposing our animals to the diseases. As I tell my clients, just because you get a vaccine for leprosy, don't go to a leper colony and start kissing everybody. Just doesn't make sense. So still maintain your animal in a safe environment. And obviously your veterinarian can examine the animal and see things that you don't see. Little lumps, little bumps that are little, but can be indication of some disease that we have to follow up on. We look in the eyes, we look in the mouth, and as I say, we examine as best we can physically the animal. If there are any signs, the veterinarian can then order blood work, which would be an analysis of the blood for different chemicals. And we can also do x-rays. Beyond that, if there's a situation that the general practitioner feels needs a specialist, we can refer to a radiologist, an oncologist, internal medicine specialist, an ophthalmologist, a neurologist. As I say, every specialty in human medicine is also a specialty in veterinary medicine.
Dr. Rogers, I have two questions, Dr. Salam here. One, you mentioned something about tick-borne illnesses in pets. Could specific tick-borne illnesses like Lyme disease be transmitted by dogs? One. And two, how come when a four-legged animal like a dog or a horse, if they fracture a leg, oftentimes they have to be put down? How come that's the case versus trying to set the fracture and allowing it to heal?
Well, first, let me say that your assumption, first let me start with the tick question. No, Lyme disease cannot be transferred to humans from dogs or cats that have been exposed to it based on a tick. That's not possible. However, if your dog comes up and has a tick on it, chances are he's been in an environment that you've been in and there are ticks. So you can still be exposed to Lyme disease where the owner has Lyme disease and the dog has Lyme disease. There's no relationship between the two. They've both been attacked by ticks, and that's separate from being transmissible from dog to cat, dog to human, or human to pet. So that's just to address the first issue. Lyme disease is but one of several diseases. Dogs can be tested for Rocky Mountain spotted fever, Ehrlichia, and Anaplasma, and several others. However, many of the oral medications to prevent ticks and fleas require that the tick or flea bite the dog. Many of the oral medications for tick and fleas, and I'm not going to mention any names, but many of the oral medications for tick and fleas, unfortunately, don't kill the animal before it bites. So there are some medications that if a tick bites, Ehrlichia, one of the tick-borne diseases, is spread within 15 minutes of the tick biting the patient. The problem is that it might not die for an hour or 2 hours. And some of the research has been a little bit confusing and a little bit misleading in saying that animals that take oral medication, Lyme will not be transmitted because the tick will die in an hour, but it takes 4 hours to transmit Lyme disease. So yes, animals can get all those diseases. And yes, we do test for them when we see an indication. Indications include lameness without any reason, rotating lameness. And so that sort of leads us into our second question. I hope I've answered your question.
Yes.
Okay, so the second question was, why do we put animals down if they fracture? Well, dogs and cats absolutely never are put down for a fracture unless the fracture is so serious that amputation is the solution. We have, as I said, in veterinary medicine, we have orthopedic, both soft tissue and hard tissue orthopedic surgeons who specialize in dogs. Dogs and cats are small animals and horses. With respect to horses, you have to realize the average horse is about 1,200 pounds. Many of our appliances to fix a fracture that are used in dogs and cats can be titanium and may withstand 600 pounds. But depending on what bone is broken in a horse, 1,200 pounds galloping is more like 3,200 pounds, and I'm guessing 3,200 pounds pressure on a plate. We don't have plates that are small enough and strong enough to always help a horse with certain fractures. So we do work on horses. We do put them in casts. We do fix them. Not all fractures, in fact, fractures.
We have our problem again as far as the voice with Dr. Rogers, unfortunately, and we're still trying to solve that. So
Dogs and cats,
he's back.
Almost always can have some treatment. Horses, less likely, depending on the fracture. Have you all frozen?
Dr. Rogers, all right, sorry about that. Let me ask another question from our question pool. Dr. Rogers, what's the best way to help it's a Beagle Basset mixed with car sickness. So, right, so it's car sickness. And how do they help them?
There are drugs we can give animals to help them with car sickness in the same way we can give Dramamine to our human patients when they get car sick or boat sick. I don't recommend giving Dramamine to a patient, an animal patient, but we do have certain drugs to help with that. Realistically, no one likes to hear that you can't give one pill and fix the problem. But realistically, the way to fix that problem, and sometimes it works, I'd say 90% of the time it works, is to take the animal, put it in a car, drive it around the block. If it doesn't get sick, put it back in the house. Drive it a little further each time. Now, that doesn't always work, but it's a good start. It requires a lot of dedication on the owner's part, but certainly that's what we hope the owner will do rather than relying on medication.
All righty. Thank you. Another question. Let's get some because we have several of them. Dr. Rogers, we have both a rescue dog and a rescue cat, but they basically tolerate each other. Should we consider rescuing a smaller dog as a companion for our rescue dog?
Well, a lot of people are anthropomorphic. In other words, they try and assign human qualities to animals. I think if you have two animals already, getting a third may not be the appropriate thing, and you'll have to have someone evaluate your two animals. There are behaviorists and even some excellent trainers who can do an evaluation. But don't forget, bringing in a third animal, you're bringing in a third personality. So unlike babies, which are born and you take care of them, animals come with in most cases, an established personality. Getting a pet like a puppy or a kitten for an aged or even mature dog or cat may be an issue in and of itself. So I would say evaluate and have someone help you. Have your veterinarian evaluate your two pets and decide whether or not a third pet would be appropriate.
Okay. And there's another question about, I have a newly rescued Chihuahua who prior to being prescribed Prozac, chased his tail obsessively throughout the day. Now, what they state is that it occurs occasionally when they're, they have other Chihuahuas, and when they're given a treat, they will and that dog is not getting the treat, he will chase his tail or he will bark, and it seems like the anxiety comes on again. Is there anything that they can do or to help their pet?
Well, again, most of these questions are behavioral.
Yeah.
And so an evaluation has to be made. One big problem, and I think Dr. Salam could speak to this, one big problem with Prozac is you really don't want to use it in an animal for the rest of its life. We do have dogs that have OCDs, obsessive compulsive disorders. We see them where they chew their tail, they run in circles, they lick their paws. We see all kinds of OCDs, and Prozac is often used. But again, the solution is not as easy as just giving a pill. The solution has to involve behavioral therapy as well.
All righty, excellent.
So I know I didn't answer the question to the fullest extent, but again, it's one of those things where it's difficult to make an assessment without a patient history, without a patient examination. But certainly, it sounds like if they can give the first treat to the dog that's having the anxiety and then move on, that might be part of a solution. The second part of that might be to put the treats in some kind of a dispensing unit, like a Kong toy or one of the other toys. Put 5 toys out. I don't know how many dogs they have, but put a treat in each toy and roll it in different directions and let the dog understand that that's where the treat is. Go chase the ball.
Mm-hmm. Right, right. There another question. I'm telling you, there are a lot of pet owners out there. Dr. Salam, go ahead.
Just a quick comment to speak to Dr. Rogers' point. Typically with OCD, behavioral treatments are very effective, like exposure and response prevention. For example, if you have someone with severe contamination fears and they're washing their hands repeatedly, because they're exposed to germs or something like that, you might want to have them touch doorknobs or public surfaces and really prevent them from washing their hands so that they actually learn how to live with the anxiety of knowingly having germs on their hands. Now, if you have a more severe case of obsessive compulsive disorder, then you might want to introduce medication. I am not, by no means am I an animal behaviorist, but when you prescribe psychotropic medication that affects people's brains or the brains of other people's children, you have to think in terms of efficacy, but also side effects. And particularly when you're dealing with younger people, children, you have to think in terms of how long they need to be on this medication and how long might they be exposed to these side effects. And that certainly has to factor into the choice of medication that you use. Now, among psychotropic medications, SSRIs like Prozac, selective serotonin reuptake inhibitors, they tend to be more benign than most psychotropic medications. I don't know if this is the case in animals, but certainly in humans, particularly children, adolescents, and young adults, one concern with using SSRIs, particularly in the beginning of a trial, is there are situations where SSRIs can increase suicidal thoughts and maybe self-injurious behaviors. So if you were to start a medication like Prozac and the person is feeling more agitated and they're having dangerous thoughts, then you may want to consider stopping the medication or switching to a new class of medication.
Absolutely. Dr. Salam is correct. Unfortunately, we don't have many of our patients try to commit suicide, though we do have aggressive self-mutilation that can occur with a dog or a cat. When I have used Prozac, we initiate with blood work and follow up with blood work every 3 to 6 months and look for any of the side effects with relation to the animal itself. Obviously, our goal is to wean, at least I think that's what we do. I don't know what's done in psychiatry.
All righty, hopefully we get Dr. Rogers back in a second. This has been an ongoing problem and we're still trying to solve his audio. Okay. We're working on it. All righty. Well, the thing of it is that, oh, thank you. Dr. Rogers, are you back?
I am back.
All right. Every once in a while, you seem to snatch away from us. And I'm sorry about that because, this is such a unique show and we have so many pets and I got so many questions coming in. All right, let's try this one. This is an interesting one. Why would someone take animal meds? Good question. Why do people allow their pets to lick their face and mouth? Isn't that it's not very sanitary? That's the question. And I see this often, even on TV commercials. Letting your dog lick you and stuff like that. What do you think about that?
Well, I think that's the same thing as what we talked about before, being anthropomorphic, assessing human traits to your pets. Your pet's licking you in the mouth or licking you in the face is not their idea. If you watch two dogs interact, they sniff each other's butts. They don't really lick each other in the face. So assigning human qualities to dogs or cats is probably the reason why people want their dog to lick them in the face. I see people that come in and hold their dogs like babies, and dogs are not usually accustomed to that, although some it can be done with some dogs, and they will sit still for that. So being anthropomorphic is one of the issues, one of my pet peeves. Animals are animals. Yes, they're important to us, and yes, we have to take care of them, but we can't treat them like little children. And a lot of young couples are getting dogs and cats and treating them as a test for having babies. And clearly, having an animal lick you in the face or having an animal sleep in your bed is not always the right thing to do. But I think there was a question before that about animal drugs and people.
Yeah, there was a question before that. Yeah, and unfortunately, it's not coming up for me right now.
Could I make a quick comment?
Sure.
I think another reason, and again, Dr. Rogers could speak to this, where you may want to have particularly young kids, and I guess adults as well, not have a dog lick you in the face, is there's a risk of actually being bitten. I know in my practice, I've seen a number of kids who have well-healed suture scars from having been bitten in the face by a dog. And I'm wondering if that increases threat or feelings of threat in the dog to have someone face so close to them in proximity to the dog's mouth, and thus increasing the risk of the person being bitten.
Dr. Salam makes an excellent point. However, some dogs will accept that. As I say, it depends on the dog. In another life, I used to train police dogs. I used to train police dogs to be aggressive. I used to train them to find people and find drugs. And when I left the group, I assigned one of my psychology students to work with the dog. Works with the dogs because it was a behavioral issue. And how do you deal with behavioral issues? You use psychology. And this lady went up and decided she was going to hug a dog and got her face ripped open. You can't assign human behaviors and humans' affections to animals. Not only licking them in the face, but hugging them. Some dogs will accept.
Okay, again, we're still experiencing that. We're trying to actually to let everybody know, we're trying to change the computer and make it more efficient as far as Dr. Rogers and answering his questions.
Well, I think I'm back.
Okay.
So as I was saying, you can't hug dogs unless the dog is willing to accept it. And I think the second point I was trying to make is, if a dog is not well trained from the time it's a puppy, it can, especially if it's a large dog, take over the house. Even if it's a small dog, it can take over the house. What it'll do is come up and you want to do something, the dog doesn't want you to do it, it'll bite. So as we recognize, not all dogs are easy to train and not all dogs are trainable, but trying to assign human attributes to a dog or a cat can result in injury, as Dr. Salam pointed out.
Dr. Rogers, I have a quick question also. There are many of us who are gardeners, and for myself personally, I garden both outdoors and indoors, both vegetables for human consumption and houseplants. What are there plants in both categories, both plants that we consume for food and plants that are ornaments that are safe and unsafe for certain household pets.
Well, with respect to unsafe plants, I think I had the first case of great toxicity in a dog. The dog ended up dying from kidney failure. But we also have problems with macadamia nuts, which I'm sure you don't grow, but Dieffenbachia, poinsettia. A big time that we see a lot of problems with ornamental plants is at Easter with the Easter lily. Even eating the leaves, eating the stems, or even drinking the water from the bottom of the plant can cause death in small animals. In terms of what an animal can eat, most fruits, such as I give my dog apples, I give my dog pieces of pear when they want it, certainly celery. But I think you have to check with your veterinarian to find out whether the health of your dog or cat would support it. Cats tend to be more fastidious and less likely to take things from you unless they're protein. Dogs are less fastidious and will go in the garbage to find things. But onions, for instance, onions will cause a blood dyscrasia or a blood problem in dogs and cats. Garlic will do the same thing. So many of the plants, if you don't know, ask your veterinarian. If you do know, if you do go on the internet, I suggest that if you're going to look up plants, then I suggest you look into any website that ends in edu, which is an educational, or gov, or your veterinarian's website. They may have some information on their website.
Yeah, that's excellent. There's another question that came up about their cat catching mice. And is this unhealthy, or can the cat catch the disease from catching mice?
Well,
Alrighty, hold on. Unfortunately, we lost this volume again. I'm sorry, Dr. Rogers. I must apologize. For some reason, we continue to lose your volume. And let's see what we can do about it. I know the engineer is trying to help it. Correct it, but. All right.
I think the word for the day is anthropomorphism, not attributing human traits to animals.
All right. We're trying to train you. We're changing Dr. Rogers' computer, and let's see if we can get one of the other computers to work more appropriately. Right now, let's go to a medical question. And Dr. Court or Dr. Aluya, my mom has lupus and has lost most of her hair. Can you explain what lupus is and how it affects you? And this is something that we find, especially in the African American community, as far as lupus is concerned. And I know even in pulmonary, I have several patients, because lupus is one of those type of diseases that affects so many organs. It even affects the lung. So they're talking about hair loss. And can you give us some indication about hair loss and maybe some of the other problems that you may find with lupus, and just a short blurb on what lupus is? Dr. Aluya, can you start off for us?
Well, thank you. Good afternoon. Sorry, I came in on late, trying to juggle work and stuff like that. So hair loss happens in multiple clinical conditions, and it can happen from babies up to adults, and it can be infectious. It can be autoimmune, as in the case of lupus. It can also be from chronic medical illnesses. It can also be from treatment with medications like cancer treatments and radiations and exposure to irritants. And it can also be from behavioral activities where you have trichomachia and hair pulling and stuff like that. But in this case, it's lupus, and it depends on the extent of what lupus the individual is suffering from. Hair loss from lupus is very common, not necessarily, but then it does happen. And lupus is an autoimmune disease where the immune system of the individuals tries to fight a particular antigen, either from a virus, either from food or stuff that the individual who was exposed to, that's been upregulated by genetic modification. So the body's immune system tries to fend off or fight off those antigen, and in the process attaches to different tissues, from tissues in the eye, tissues in the brain, where you have lupus erythritis, tissues in the eye, ophthalmoplegia. It can actually affect the heart. It can affect the kidneys as well. It can affect almost every organ. So in this case, it may actually attach to the hair follicles of the hair, and in the process destroy those follicles. So that's most likely what's happening here.
In terms of treatment?
Oh, treatment again. There's so many treatments in terms of that, but in this case, first, you have to see your primary doctor, who would set up a coordinated or organized treatment therapy with your rheumatologist, and of course with the dermatologist as well. Want to identify what the true cause of that hair loss is. Is it from infection? Because sometimes your autoimmune system disease like lupus can affect your immune system to the point that you cannot mount a response against a disease. So it can be a fungal infection that's affecting the scalp. It can also be a bacterial infection that's also affecting the scalp. And sometimes you have a combination of both. So you have to know which it is and treat them accordingly. So using antibiotics or using anti-fungal medications. But then if it's not, and that's been ruled out, then of course you can use immune modulants, medications that will help, treat the lupus itself, de-escalate the intensity of the immune response, so that it doesn't affect the hair follicles as much as it should be.
In
It is
addition,
important to recognize, I'd like to add that even though the initial manifestation of lupus being one system or other, that it is of a diffuse nature, as was mentioned by Dr. Aluha. And in that regard, maybe up to 50% of patients who have lupus over a prolonged period of time may have involvement of the heart. This can involve all of the layers of the heart. From the outside, which is the pericardium, the sac in which the heart fills, that may be in which the heart sits, that may become inflamed, causing what's called pericarditis, and even a fluid may form in there called pericardial effusion. It can affect the muscle, the bulk of the heart, the myocardium or muscle, and that may be inflamed as well, causing a myocarditis with potentially very serious consequences. And of course, we are aware that the inner portion or endocardium or lining, which includes the valves of the heart, the 4 valves of the heart, these may also become inflamed and cause some diseases which can be recognized as being related to the presence of lupus. So when a patient presents with lupus in any one part of the body, it's important to recognize the potential for involving many other areas, including the heart.
Excellent.
Yeah, I think, Dr. Aluya and Dr. Atherley is on to something here, because, when we think of lupus as an autoimmune disorder, it's also part of a spectrum. And Nelson, you can help me out here. I've had a couple of patients who've come to me with mixed connective tissue disorder, kind of a similar phenomenon. The consequence with respect to gynecology and gynecologic malignancy is these patients are also susceptible to many viruses, of which HPV, human papillomavirus, is one of them. And we often see these patients with chronic lower genital tract dysplastic disorders, cervical dysplasia, vaginal dysplasia, dermatologic dysplasia around the vaginal and opening, the vulva. So to your point, Dr. Atherley, when someone comes in and says, I have lupus, as a physician, whether a primary care physician or otherwise, you kind of think globally as to the other organ systems that can be affected: the kidney, the lung, the eyes, the reproductive tract.
Yeah, you're very right, Dr. Anderson. It's a spectrum, and do we completely know everything about autoimmune diseases as it is? No. One of the other, connective tissues that we do have, I mean, we have Waterstrom, gamma globinomia, we have lupus, we have what do you call it? Misconnected tissue disease that's in itself an entity. You have tests to identify um, um, if it is actually a misconnected tissue as compared to an exclusive lupus-like disease. And you also have scleroderma, systemic and cutaneous. So all of this mix do go in between them, one or the other. But to identify if it's lupus itself is to do what it's called, the test called is double-stranded DNA. It actually used to identify and diagnose lupus, and as well as to use it as a measure of control in the treatment or response to lupus itself. Then you have the anti-RMP, ribonucleic protein antibodies. That's to identify individuals with misconnected tissue disease. And Dr. Anderson, I'm sure you know, and you've seen individuals with lupus who come in with repeated abortions. And that's why they tend to do, what do you call it, anti-La, anti-Ro antibodies to see those who are at risk for miscarriages and stuff like that. So yes, it's a big and complex disease. And anybody who has that has to have a complex, a wide range approach to it. It needs a multidisciplinary, approach to the disease.
In reference to the caller,
Say that again, Dr. Court.
I think the caller wanted to know what treatments can be used to treat the alopecia. I think Nelson alluded to a few of them, but in addition, sunscreens can be helpful. In addition to topical steroids as well as injectable steroids. And the other part of it that works is hydroxychloroquine, which is an anti-malarial. But in addition to all of these, of course, you have to treat the lupus because that's the cause of what the condition, any condition that develops as a result of it.
I know also other diseases that you may not think of in that realm of lupus are things like arthritis and severe arthritis and colitis and ulcerative colitis and Crohn's disease. These are some of the things that may have that chronic inflammatory reaction as well. I know these diseases, they definitely have an associated problem with the lung. They cause interstitial lung disease or scarring of the lung tissue, which is a very bad problem. And with lupus, there's something called lupus pneumonitis, or an inflammatory reaction in the lung secondary to whatever's causing the lupus. And you have increased chances of developing pneumonia with these. And then there is a hemorrhagic syndrome that's associated with lupus in the lung as well. So as you said, it's a multi-system disease that, and it's not uncommon. And it's very common. And if you think that out there, if you have any lupus-like syndromes, you should definitely consult your primary care physician so you can be worked up and treated appropriately. Any other comments on this? Yeah.
So Dr. Aluya had mentioned from a fertility perspective, recurrent pregnancy loss, but also, when pregnancy progresses, it's a relative immunosuppressive state. And if one is young and with lupus, and become pregnant as the pregnancy progresses, they could encounter what we describe as lupus flare, which could be a worsening of a pneumonitis, could be worsening pericarditis, it could be worsening renal failure. So again, to Dr. Aluya's point, anyone with any of these autoimmune disorders, whether it's Sjogren's disease, lupus, scleroderma, they should be cared for in a multi-specialty type of an environment.
I agree. I agree completely, definitely. At this particular point, we've reached our halfway point. So let me just go through our usual routine here. As far as, and let me do this. All righty. So I know that there are people that have joined during the webinar, and we did not get a chance to properly introduce ourselves to those people. So Dr. Court, can you start off and let's reintroduce ourselves?
My name is Dr. James Court. I practice in East Orange, New Jersey. My specialty is internal medicine, and I graduated from Howard University Medical School.
Excellent, excellent. Dr. Atherley, please.
I'm a board certified cardiologist practicing predominantly in the Essex County area out of Newark Bethesda Medical Center.
Excellent. Dr. Patrick Anderson.
Yes, so I'm Patrick Anderson. I'm a board certified gynecologic oncology, chief of GYN oncology at Newark Bethesda Medical Center. Happy to be here.
All righty. And Dr. Aluya, please.
Yeah, good afternoon once again. Nelson Aluya, a medical advocate, medicine pediatrics trained, practice out of Newark Bethesda Medical Center, and assistant professor of medicine. It's a pleasure to be here once again.
All righty. And Dr. Rogers, can you introduce yourself, please?
Yeah, I'm Dr. Ernest Rogers. I'm a veterinarian, not a physician. I graduated from Tuskegee University and then did a PhD at Virginia Tech, and I practice in Maplewood.
All right, thank you. And I'm Dr. Omar Bey, a pulmonary critical care physician with the subspecialty in nutrition, and I am Director of Nutritional Support for the ICU at Newark Bethesda Medical Center. Thank you very much. Understand that our webinar is every second Saturday at 1 o'clock, 1 p.m. Eastern time. And please tell everyone, tell your family members and all that they should join us and take in all of the health knowledge that we're bestowing out here with these excellent physicians that come on with me. And I appreciate each and every one of them. You can see our prior webinars on Zoom. Just go to OBHealthy on Zoom and please take advantage of that. The most important thing I can say is please do not change any aspect of your medical care before you consult your physician. Only your physician can truly know how to best treat you from a medical standpoint. And I'd like to thank OBHealthy for allowing us to use their platform. Also with OBHealthy, understand that they have a free health app. The health app is Eating Healthy. It's weight loss as well as health and wellness. If you really are into your health and your wellness, download their app. The app is free. You just have to put the coupon code 365. That's coupon 365, and the app is free, and you will definitely be understand that health is the most important thing as far as we're concerned, and we're here every second Saturday. And please come and join us. All righty. Okay, thanks. Let's get back to some questions. Dr. Anderson, there was a question that came through. Why for some people it takes so long and such a long time to recognize that they have ovarian carcinoma?
Well, the truth of the matter is the symptoms of ovarian cancer is usually vague and is usually attributed to oftentimes just regular chronic discomfort, gas pains, weight gain. But when you look at the true symptoms of ovarian cancer, and a colleague of mine, one of my former professors, actually wrote a paper that indicated that most patients with ovarian cancer do have symptoms, and it's a matter of interpretation. Many of these symptoms include, just some bloating. Many women think, oh, they're just gaining weight because of dietary reason, vague abdominal pain that we often say is gas. When you look at the age group for many women who develop ovarian cancer, many of these women are perimenopausal, so they get irregular bleeding and they chalk it up to being perimenopausal, meaning approaching menopause. Many women will have urinary symptoms, and many women will say, well, maybe I just drink some more cranberry juice. It's a urinary tract infection, which is common in women, more so than men, and they'll hydrate themselves, they'll acidify the urine via natural means and wait and see the symptoms will go away. And on top of which, the abdominal cavity is a wide open space, and there's room for fluid to collect and tumors to grow. And oftentimes, I often say to patients, when you start to become symptomatic from a cancer, it's because now that cancer is growing in a space that's been congested. So for example, a head and neck cancers, for example, will cause symptoms way earlier than, say, uterine cancer because there's so much space to grow. So those are the typical reasons. And unfortunately, unlike many other cancers like colon cancer, like cervical cancer, like lung cancer, there is no real good screening test that provider can apply, except in certain high-risk groups. So, one of the best remedy with respect to screening and early diagnosis is identifying one's risk factors. So in your medical history should be a comprehensive evaluation of your family history, because most of these cancers, many of these cancers are part of a cancer syndrome, or, if you look carefully at your family, there is a pedigree. That may not necessarily highlight ovarian cancer, but may be part of other types of cancers. So with respect to that, we know that certain screening modalities, such as a pelvic exam combined with ultrasound, a pelvic exam, ultrasound, and certain blood tests in certain high-risk groups can be beneficial.
Patrick, is there use for CA125?
CA125, like many other tumor markers, these are antigens that are secreted in the blood when certain surfaces are irritated or are stimulated. So for example, CA125 is a very non-specific marker. It's an antigen that's secreted in the blood and can be measured. However, there are many conditions in which CA125 is also elevated. Congestive heart failure, for example, right heart failure, liver disease, anything that irritates the peritoneal lining can cause the CA125 to be increased, fibroid tumors. So as a diagnostic tool or as a screening modality, it's not very effective. The specificity and the sensitivity is quite low. However, again, in specific groups, when there are certain conditions, so for example, in specific groups, when there's an ovarian tumor, even when it looks benign on imaging with elevated tumor markers, at least half the times, those tumors are some sort of a malignancy, at least of a low malignant potential. So to answer your question, as a screening modality, it's not a very good screening modality.
What, if I may ask, what's the relationship between ovarian cancer and breast cancer? And if, you need to pay attention more if you have that in the family history and stuff like that.
Yes, so there are many cancer syndromes, like I said, where different cancers are part of a spectrum of illnesses. So for example, with respect to breast cancer, we know that in certain patients with BRCA mutation, which is the breast cancer gene, and the two main ones that people talk about is the BRCA1 and BRCA2, there is an increase in ovarian cancer in many of those patients. There is an increase in endometrial cancer in many of those patients.
If I can just point out that everything Dr. Anderson has indicated is also true of our pets. It should also be pointed out that the majority of our pets are spayed or neutered, and so ovarian cancer is rare, but we do diagnose ovarian cancer and an infected uterus called the pyometra. So I want people to understand that all these things that we're talking about today, even though it's discussing humans, all those possibilities can exist in their pets as well.
Yes.
And the two main features. So
Okay, excellent. I'm here looking at my, so let me see if I can tap that off. Hold on for a second.
So I have a question for Dr. Rogers. Now, I know we live in a time where we're facing some of the worst viral infection that in the last 100 years have, met man in terms of being so virulent and stuff like that. And I got to know about a disease, a viral infection that affects animals, especially dogs, and came to realize how effective, virulent it can be. But I've always wondered if it really affects man as well, and that's the canine distemper virus. And what's your take on that? And does it really affect man as well?
Well, my opinion, though, it's minimally educated. I don't believe I'm fairly sure that no, this canine distemper will not affect man. It's very unique to canines. In fact, it doesn't even affect felines or cats. My take is that it's unlikely to affect man, simply because as a young technician in a veterinary hospital, I drew blood from a dog that had canine distemper, put down the needle, and then proceeded to stab myself. And that was probably 45 years ago. And as far as I know, I don't have canine distemper. So, that's an N of one, but certainly I think I don't know of any research, although I'm not completely educated on the fact, I don't know of any research that says that disease in particular can be spread from dogs to humans. Other diseases can, but that is not one of them.
All right.
Is it terminal when a dog gets canal distemper? Because I mean, from my exposure from Nigeria and all that, it was almost like a time to give up and put the dog down when you get a dog with infection like that.
Well, I think today in current medicine, we can treat almost every dog if we can get it early enough. Clearly, we have restrictions on travel with animals, and so that sort of has helped restrict the spread of canine distemper. It basically doesn't exist to any great extent in North America. However, early in my practice, I had 6 puppies that came in from Georgia, all of which within a day of arriving were very, very sick, and it was diagnosed with canine distemper. Part of the problem is you cannot take animals, vaccinate them, and these animals were vaccinated for canine distemper, vaccinate them, and then stress them out by shipping them 100, 200, 300 miles. You lower their ability to fight off any infection. Not that the vaccine itself caused the infection, but the patients were probably already exposed without sufficient protection from the vaccine. A vaccine takes anywhere from 2 to 4 weeks to work, and we usually say 3 weeks. So if you give a vaccine to an animal, they should not they subsequently will need at least 1, if not 2 boosters, but it's unlikely that they'll get distemper if properly handled. I have seen animals with distemper, and currently it's an ICU type thing. It's IV, oxygen as necessary, antibiotics, and nutritional support for these animals, and hope they make it. There's no magic tool, although some of the researchers in the veterinary schools, all 36 or 32 of them throughout North America, may have an objection to my statement.
What are some of the,
Go ahead,
Dr.
Dr.
Court, what are some of the symptoms of canine distemper?
The biggest symptom is discharge from the nose, nasal discharge. We will see ocular discharge. Those are the 2 big symptoms. And what we call failing puppy syndrome, where the dog is just not doing well. We see that for a lot of reasons, but with nasal discharge, ocular discharge coming from an environment where there has been or known to be outbreaks of distemper, those are the 3 big things that we look. It's mostly an epidemiological and physical examination. Once we have that, we can then do a conjunctival or an NI, pink part of the eye smear, and send it in for diagnosis with, I'm not sure what they're using now. They used to use fluorescent antibodies. I'm not sure what they're using now. And then we get our diagnosis, and then we can treat them based on that diagnosis. Not all of them survive, but not all of them die either. So.
Is this like a clear discharge or pus or
this is usually
what kind of discharge?
The nasal discharge is usually green. It's not clear. It's usually green. It's copious. It's very thick, mucinous, and similarly with the eye discharge. We also can have diarrhea, which is a big sign. However, that's also a sign of parvovirus. Parvoviridae is an infection that puppies get. Puppies are very susceptible to a lot of diseases. And in getting a puppy in that's dehydrated, with discharge, with diarrhea, particularly if there's blood, we start thinking parvovirus, distemper. It could be herpes, it could be hepatitis. Well, unlikely hepatitis, but that's one of the rule outs that we have.
Dr. Rogers, as a cardiologist, of course, I'm always intrigued by anything to do with the heart. And let me ask you a question about heart disease in dogs or in other animals, especially with reference to the fact that we owe a lot to the work done earlier on dogs with digitalis leaf from the foxglove. That's where it was developed maybe 300 years ago and became the most popularly used drug in cardiology. Do you see congestive heart failure in dogs? How often does it occur?
I see it quite often. It's treated with a drug that we use called pimobendin. It depends on whether it's right and left-sided. Obviously, when I see it, I'm diagnosing it based on signs and symptoms. But then usually I will refer it to a cardiologist. We have veterinary cardiologists. One of my friends is a veterinary cardiologist. And then we'll put them on spironolactone, lactone, Lasix. Depends on what we have to do and what side of the heart is affected. Before I start treating, I like to do an EKG. I like to do chest x-rays, and we do blood work just to see what the status of the animal is before we start any treatment. And then if I can get a cardiologist to do an echocardiogram or an ultrasound of the heart, that gives us better insight. Congestive heart failure is actually breed related. So we see certain breeds that are more likely to get it than other breeds. But it also depends on the health status of the animal and what infections the animal's been exposed to as a puppy. So yes, we can treat it, and we have very good diagnostics, including color Doppler. We have interventional radiologists that can give us further information. We use MRI and CT as needed.
Excellent.
Thank you.
So Dr. Rogers, you come from a unique perspective as a PhD. And we came through a period where, we struggle with convincing folks to take the COVID vaccine. And oftentimes the chatter is, I'm not going to be anybody's guinea pig. Can you speak to the respect and the strict standards that are used in animal research?
Well, first, let me say what I did as a PA. I do have my medical degree, which is a doctor of veterinary medicine, but then I went on to do a PhD. My PhD, the area was immunopharmacology, or the study of immunology related to pharmacology or toxicology. And specifically what I looked at were vaccines related to animal infectious respiratory disease. And what I found with some vaccines was that there are side effects, there's no question, but vaccines work. I think the biggest issue now is how could we get a vaccine out there in, I don't know, what was it, a year and a half? Whereas most vaccines take 10 or 12 years. Well, it's because of the nature of the problem and the number of people and the intensity put into developing these vaccines. Now, these vaccines, I think everyone should have respect for them. And I keep saying that. I keep telling people who come into my office, you can believe in God, but you can also get a vaccine. I think animal research, and I did work for a time in a drug company called Schering-Plough. Animal research is one of those things that it's not done on a one animal here. It's done on 1,000 animals, 1,000, maybe 4 or 5 different species. At least when I was in research, we did it on 5 or 6 different species. We had to convince the FDA that it was safe. Veterinarians, unlike physicians, we work on many different species. And if we see something in one species that we don't see in another species, we want to know why. The species are often selected based on their slightly different physiology so that we cover all the bases when we're developing a vaccine or a drug. And that we know now that if we have safety and when we do the safety study, it's 1, the normal dose, 5 times the normal dose, and 10 times the normal dose. And if we don't see problems with any of those, we know there are going to be problems. I mean, you're going from 10,000 animals to 2 million people. So there are going to be some side effects. But in general, animal research speaks to the issue of safety and efficacy. But beyond that, they do studies, physicians and nurses do studies looking at the vaccines in humans. And though it's not 100,000 or 200,000 people, it's often sufficiently large enough that based on the animal research with different species, the people research or the human research is identifying if there's a problem. And then the FDA says, based on all this research, we feel comfortable saying that this drug or this vaccine should be used because the risk is so low compared to the benefit. So if I can step on my soapbox here, get the vaccine.
All right. And I just want to make it clear, we're talking about COVID.
Correct.
Right. And it's interesting that, when you look at the spectrum of our experiences, like I myself who spent some time in a basic science lab working with RNA in cancer therapy and cancer physiology, just to have folks know that it's not just vaccines, it's also other medications like cancer therapy. We use the Ishikawa cells, rat cells, to develop a certain strain of uterine cancer in order to study the history, the pathophysiology of these kind of cancers before we even start to think about, implementing some of these approaches in human. So, when folks look at the alacrity or the speed with which certain vaccines are developed, they need to also understand that based on some of the research that's done in animal labs, those platforms have already been developed, and you're not starting from ground zero, so to speak. So, mRNA vaccines have been around for many years. Probably not as long as the use of attenuated viruses, but all that contributes to the speed at which these vaccine comes along. And you speak to, the severity of the virus that we're dealing with, the number of people affected, the amount of resource that goes into it. And some of the conspiracy theories that comes along is there's money to be made from these vaccines. So we'll go from 1 dose to 2 doses. Now we're talking about boosters. And I think, you go back to some of the animal studies, from animal studies and vaccines, you do understand how people track T-cell responses and antibody responses to some of these vaccines. I know that it would make sense. It's good immunologic tenets to recommend boosters in many situations.
Well, I think
Who's next? Dr. Cord?
My question is, do you think what is done in animals is the same thing as done in humans? For example, you said 1 dose, then 5 times, and 10 times. Is it the same principle as used in adults?
Well, first, if I could just address something Dr. Anderson said, I think we have to understand that science is based on like a staircase. You don't get to the 4th floor without going through 1, 2, 3 floors. So I think we have to understand that anything related to vaccines are based on a wealth of science going back hundreds of years. And then Dr. Court, in relationship to your question, I think one of the things that we have to realize is in animal studies, we're looking at safety. We want to know if we give this drug, does the liver stop? Does the kidney stop? Does the brain turn to mush? And so that's why we give 1 dose, the normal dose, 5 times that, and 10 times that. We're trying to prove to the FDA that side effects in multiple species, not humans necessarily, but in multiple species, that it's safe at those levels. Any drug that doesn't work out will probably be shipped back for humans, doesn't work out for humans, or any vaccine that doesn't work out for humans may be shipped back to vaccine for animals. So yes, I think it is the same in terms of the procedures developing a drug for humans. Did I answer your question, or?
Yes, it did.
Yeah. Was there another question, Doctor? Who else had a question? I'm not sure. I didn't want to cut anyone off. All righty. There was a question.
I have
Go ahead,
a question
Nelson.
on for those who keep birds like parrots, what would be your advice for them regards to bed-related infections like psittacosis and stuff like that? And where would how much of a distance you expect them, or how do we keep them and stuff like that? I have family friends who do that, and it's always concerning when I see them.
Who is the question for?
For Dr. Rogers,
Oh,
birds.
I'm sorry. So you're talking about COVID and distancing?
No, birds.
Birds.
Birds and bird-related
Psittacosis?
infections.
Oh,
Like
citizens. Okay.
Psittacosis.
I think what we have to realize is that every animal carries bacteria. I know of at least 1 veterinary technician who was doing a dental cleaning, and a piece of tartar fell into her eye. She lost her eye. I know of another technician who was working with primates, got bitten and lost her arm because the infection couldn't be controlled. I know of a veterinarian who's working in a lab, put his hand down on the workbench without realizing that it hadn't been cleaned, and he almost died. He was in the hospital for 3 months. So I think we have to realize that not only birds, but any animal can have bacteria that we don't expect them to have, or mutated bacteria that can be very serious in humans. I get bitten every once in a while, and I get scratched every once in a while. I get peed on and pooped on every day. So it's general good health is what's going to prevent it. I don't know if that answers your question.
Yeah. All right. There's another question that came in. You may have answered this, but can you answer it again, because your audio went out when you were answering it, and I think it's a good question. It says, my cat, can it catch certain diseases when it's catching mice? So, you know, cats, they catch mice. Can they catch diseases from those mice?
Yes, we discussed leptospirosis previously, and that's one of the big diseases they can catch from mice. Rabies is very unlikely to be caught from mice, but the biggest number of cats I see that get into problems from catching mice or rats is poisoning. Because typically people put out poison for a rat, the rat eats it, the rat can't run, the rat can't get away. So even a blind cat can catch a dying mouse. The problem is that there's often either a neurotoxic, hematological toxic poison in this mouse, and when the cat eats it, they then develop the symptoms and signs of that kind of a toxin. So in terms of cats, barn cats live for years and years and years, and they catch mice and rats every day and don't seem to have much of a problem. A lot of the barn cats are just healthy as heck, and I'm not quite sure what happens, but they usually end up getting run over by a car and not dying of a disease. So yes, it's possible that cats can get diseases from catching mice and rats. However, I don't see it as a big incident, and it's particularly not in this urban area. The most common thing is leptospirosis, which is a spirochetal disease, or the organism that causes the disease is a spirochete, sort of like a corkscrew bacteria, if you will. And once that's in the animal, it causes kidney and liver problems.
Mm-hmm. There's another question that came through, and it says, how common is cancer in dogs?
Well, I can tell you that I put 3 dogs down this week that had cancer. Mm-hmm. It seems to go in cycles. But I would say from January, all different cancers, skin cancers, intestinal cancers. I had a cat that unfortunately has passed on with what seems to be a lymphatic cancer. We have ovarian cancer, surprisingly enough, in our cats and dogs that aren't spayed. So it's fairly common. I guess I would say particularly in older animals, but I've seen lymphoma in a dog as young as 6 months. Mm-hmm. Yeah. So it's fairly common. We hope that most of our dogs are examined on a regular basis, and we get to do the biopsy and diagnosis as early as possible. Unfortunately, our human patients, our human clients, don't always recognize the signs and symptoms, and when they do see them, they pass them off. And I've had tumors the size of a grapefruit come in on a dog, and at that point, even though surgery is possible, it takes all my skill to do plastic surgery to close a skin lesion that's the size of a grapefruit. So yes, cancer is very common in animals for a lot of different reasons. And as all the physicians here know, it can be due to exposure to certain chemicals, it can be due to a genetic problem, or it can be due to radiation, or not necessarily radiation, but some other exposure that causes a change in the cell chemistry and biology.
Are there certain breeds that may get cancer, or the breeding of dogs, you know, the mixed breeding and stuff like that may increase the chance of cancer and other types of diseases as well?
Well, we do know that some breeds are more susceptible to cancer than other breeds. Springer Spaniel is one of those. My dog, which was a Malinois, a Dutch Shepherd, got cancer, and I had to put her down about 1.5 years ago. So yes, we do see cancer in a lot of different breeds. In terms of breeding, because the laws have changed and made it so difficult for breeders to get animals that are, say, brother, sister, or mother, son bred, they tend to have a higher incidence of they can have a higher incidence of cancer, because of the mixed genetics or the non-mixed genetics. So we're seeing less and less of that type of poor breeding. But that doesn't mean that we can't get cancer based on breeds and breeding techniques. But that's becoming, I've seen less and less of it. I'm one veterinarian who has about 4,000 patients. So I don't know if I'm the best marker of how often it occurs. But in my practice, I probably have seen since January diagnosed and euthanized probably 15 patients.
Right. You know, on a personal note, last year, my dog, one of my dogs we had to put her down, and she had liver cancer, and she was about 10 years old. So it was a big issue. And we talk about the emotional aspect and they being a part of your family, and it's real. And it's a big loss. So I understand what you're talking about.
Well, liver cancer and kidney cancer are often related to something that they've gotten into. Dogs are non-discriminant, as I said previously.
Mhm.
Drinking water out of the backyard can expose them. Drinking water out of the backyard can expose them to all kinds of different parasites. And we found there are records in the literature that indicate that intestinal parasites in dogs appear to make them more susceptible to intestinal cancer. So there are a lot of issues here that we haven't addressed yet.
Yeah, I can imagine. And just also something on a personal note, I have a lot of deer in my backyard, in my front yard, in our neighbor's yard. I mean, it seems as though, and we live in a community, but we're not far from the reservation. Yeah. But the thing of it is that, is there any concern with the dog, the one dog that we have left, with the deer that are there all the time in my backyard?
Well, deer and snails are part of the health cycle of the tick. And one of the problems is deers are herbivores. They usually only eat vegetables, fruit, leaves. And so parasites, I've seen parasites or herbivore parasites in carnivores like dogs and cats. That's usually because the dogs go out and eat the poop from the deer.
Right.
But in terms of health-related instances, I think the most common one is that the deer travel much more freely and can travel with parasites on them. So they can drop ticks, they can bring in urine that may or may not be contaminated with whatever they've eaten. But in terms of deers and dog interactions, I don't know, although it's not an educated opinion, I don't know that there's any dog-deer interactions or cat-deer interactions that specifically transfers a disease.
Okay. All right, thank you. Dr. Atherley, we're going to go to a medical question. How about that? If a heart attack hurts or destroys heart muscle, why is it some people have no pain associated with it?
Good question. Well, the appreciation of pain requires not only the damage to occur, but it requires the sensation to be taken by nerves at the site of the problem up to the brain so that the brain can recognize that such is occurring. Now, there are some disease processes which give rise to affecting and deadening the pain appreciation, and these may be associated with painless heart attacks, but it is far more common than we recognized before. So that nowadays, maybe 30% of patients may have the heart attacks that could be quite significant and may be clearly demonstrable by testing, but without having the usual symptoms. So first of all, there should be an awareness of the actual symptom that you have with a heart attack, and then aware of the pseudo symptoms, the symptoms which are a little different and may not be recognized as symptoms that relate to the heart. And lastly, the recognition that there may be no symptoms at all. So the typical symptoms that one would associate with a heart attack relate to pain, and the specific kind of pain we're talking about is a pressure, squeezing, tightness, or heaviness occurring not to the left side as people think the heart is located, but instead in the center of the chest, the area we call the so-called retrosternal area. So the severe kind of pain And then you judge by the company it keeps, as we've often been told when we were young about the company we keep and how we're ourselves judged. So if the pain is associated with profuse sweating, cold sweats, shortness of breath, palpitations or fluttering in the chest, dizziness, faintness, then this may make that pain more significant. So once you look at the pain, look at the accompanying features, and recognize the fact that sometimes there may be atypical or different presentations of the pain. So while I just described to you the typical unusual way, then sometimes the pain feels like an indigestion, like you had something that didn't agree with your stomach. Sometimes you don't feel the pain at all, but you feel the other associated features that I mentioned: unusual shortness of breath, a feeling of faintness or palpitations, breaking out in a cold sweat without a clear reason as to why. These may also be clues. So in looking at the diagnosis of this, we have to assume and look at a lot of different factors that may predispose such an individual to heart attack, so that when the physician evaluates such, we put a lot of things into consideration, take a lot of things into consideration, and not merely the pain. So yes, in answer to your question, there will be patients who may have no pain or different pain who can be having heart attacks. Heart attacks do not invariably carry pain or be associated with pain, although it is still the best symptom and the most significant one that we recognize when the heart attack is occurring.
Yeah, I know that.
If I may ask
Go ahead.
Dr. answer the question. Very typically, we talk about women who die, an event of a heart attack more often than men, because they tend not to recognize, or present a typical form with heart attacks. And then Dr. Atherley, this question for you. What's the relationship with diabetes and heart attacks, in the context of painless myocardial infarction that they always talk about? What's your take on that?
Yeah, diabetes is one of the identified diseases that affects our appreciation of pain. And so the nerves are affected by diabetic type neuropathy or affecting, blunting the pain response. So that, yes, diabetics are one of the diseases that we associate with painless or different pain. So it is, if one has that as a risk factor, you should be aware, your physician should be aware that you may, in fact, or the individual with diabetes may have a heart attack and not recognize it simply because that is one. There's some other diseases, but that is one that we look at. Another concern, of course, is people who've had heart attacks before, because at the time of had heart surgery before, at the time of heart surgery, the surgeon cuts the nerves to the heart muscle, and these may have a higher percentage of painless heart attacks. People who've had heart attacks before may have a higher percentage of painless heart attacks. So there are several specific subgroups of individuals who may be more subject. But in general, in the painless heart attacks, we look at sociological groups and elderly. And of course, you mentioned that females more commonly than males may have painless heart attacks.
Mm-hmm. Excellent, excellent. Dr. Court, I have a question that's come through. It says, it is very easy for me to catch a cold or sore throat, and I've been told that I have large tonsils. Do you think that is a reason? And if so, what should be done about it because I'm an older adult?
Having large tonsils, I don't think that predisposes you to catch a cold, because most colds are caused by viruses, something in the atmosphere, something that you breathe in. So I don't see a relationship between having large tonsils and makes you susceptible to having a cold.
Right. What about the sore throat aspect? I know that in my area with the pulmonary, I'm always dealing with hoarseness and sore throat and coughing. Would large tonsils be a problem as far as that's concerned? And also with the allergies even, or in different allergies, may that be a problem?
It is possible, because if, say, for example, you have pharyngitis, if they're infected, in addition to the large tonsils, you have other symptoms like fever and chills. And when you look at the patient's throat, if you see evidence of an exudate, yes, that is possible. But without those, just enlarged tonsils, I don't think that automatically qualifies you to have colds all the time. No.
Right, right.
I
Okay.
mean, usually in kids, we tend to see this a lot, where they call them the kissing tonsils. They're really big, and that's because relatively to the size of the neck, and kids have prone more to viral infection and environmental exposure and stuff like that, and putting things in their mouth. So remember that the tonsils are guards. They're just there to trap infection that comes to the head and neck. So once anything that comes somewhere to the ear, to the eye, as they're exposed to, they trap them all there. And over time, they get really big, and then they get to a point where, sometimes it may cause respiratory problems. And then, again, trapping of fluid, that passes between the nose and the ears and the mouth. So that keeps them, gives them that intention, like that outcomes of looking like they have more ear infections. But usually we tend to refer them to ENT to get them, tonsils removed if it's beginning to cause them, sleeping problems like sleep apneas and other stuff like that. But just for the fact that, it causes repeated infections, no, it's not truly an indication anymore. But then, they tend to outgrow it as they grow bigger.
Okay, excellent, excellent. Dr. Anderson, there's a question that came through. If you have cervical cancer, when do I start screening? And is there a time that comes along in age that one would stop screening for cervical cancer?
So if you repeat the question, you said, if I have cervical cancer.
Yeah,
So
well, go
we
ahead.
can talk about screening and we can talk about diagnosis. And it's,
Okay, well,
two different approaches.
I think both are important, bro. All right.
So typically, screening begins at age 21, and the approach is a little bit different than what most people are accustomed to. In the past, it used to be you begin screening at age 18, or when a young lady first begin sexual encounters. However, based on the science with respect to the virology of cervical cancer, which we know cervical cancer is technically an infectious disease. It's caused by the human papillomavirus in most cases. There are cervical cancers that are typically, there are two types of cervical cancers. There's the squamous cells. Squamous cells are the cells that covers the cervix, which is similar to the cells that covers your skin. And then there is adenocarcinomas, which are glands, cancers that develops in the glands, which glands are identified in the canal of the cervix. And then there's both squamous cell and adenocarcinomas, which originate in the cervix, and they are the ones that comes from other places, such as the uterus, the ovaries, sometimes even breasts. And there are other types, such as melanomas, which are a little bit rarer. So with respect to screening, the current recommendation is screening begins at 21. And at that point, it's a cytologic screening, meaning we look just at the cells. If we see any abnormalities in those cells, there's usually a reflex test done, meaning it would immediately reflex to looking at the HPV, the human papilloma profile, to see if there's an associated high-risk HPV or human papillomavirus. Now, there are several serotypes of human papillomavirus, of which we tend to focus about 7 to 10 of the high-risk groups. Typically, type 16, 18, 45, 31, 33 are the ones that are responsible for almost all of the virally related cervical cancer. Now, in most cases, if the recommendation is if we do cytology and there is no prior history of cervical abnormality or dysplastic disease, and there is no abnormal HPV profile, then those patients are rescreened every 3 years. Now, doing cervical cancer screening and doing pelvic exam is two different issues. Many people think that when they get a pelvic exam, a pap smear has been done, and that's often not the case. It depends on the specific reason you see the doctor and the symptoms that you might be having. But with respect to screening cervical cancer itself, after age 21 and below the age 25, the recommendation is cytology, and a reflex viral profile is done based on abnormalities or the type of abnormalities that may show up on a pap smear.
Okay.
Over the age of 35, we do the dual test, both the cytology and the HPV testing. In the event both tests are negative and there's no prior history, then the screening occurs every 5 years. And then there are specific algorithms as to how you continue to evaluate patients should there be any abnormalities that arises. Now, with respect to diagnosis, oftentimes the symptoms of cervical cancer, like many early cancers, are asymptomatic, meaning patients have no symptoms. And usually when symptoms such as discharge, bleeding, bleeding after intercourse, or pain, when they occur, usually you're already talking about advanced disease. Diagnosis is usually made by doing a good comprehensive pelvic exam with a focus on the cervix. And diagnosis is typically made by doing a biopsy of the cervix. Now, oftentimes, like I said, when you have symptoms and you examine the patient, oftentimes you can see a lesion, and that lesion could look like a growth or an ulcer on the cervix. Should you see that, you do a biopsy. When you have an abnormal screening test, depending on the type of abnormality, that may warrant what we call a colposcopy, which is a microscopic evaluation of the cervix where 3 to 5% acetic acid is applied to the cervix, and there is certain characteristics that you see with the application of the vinegar, certain lesions, certain characteristics within the lesion that you can see on this using the colposcope, which amplifies the surface texture of the cervix. And should you see an abnormality, then that calls for a biopsy to be performed.
Excellent.
Patrick, one question. Is cervical cancer due to HPV considered an STD? And if so, what's the incidence?
It is considered a sexually transmitted infection, and it actually caused the adjustment of certain other diagnoses. So for example, someone who's HIV positive really doesn't have AIDS. However, if you're HIV positive and you have cervical cancer, then that may change the diagnosis because now it speaks to a perceived adjustment in your own immune competence. With respect to the incidence of cervical cancer is actually in today's environment a little bit of a conundrum to identify because now we have HPV vaccines. And based on current studies, we've already seen a decline in the incidence of many cervical cancer. Some papers have talked about actually a 50% decline in cervical cancer. The reason the incidence is so varied, it also depends on the environment. So for example, the incidence in certain developed countries is much higher than in, say, the United States, where vaccine is usually a part of every young person's, both male and female, profile for them to get into school. So it's not unusual, but in the United States, we see probably about 14,000 new cases per year. And obviously that changes with respect to the different demographics. I can tell you where we practice, I see very few operable cervical cancer. However, it doesn't mean that all we see is inoperable cervical cancer. And I think this speaks to the fact that, even though there are not necessarily loopholes, but access issues and parities in who gets screened and how screening gets done and who does the screening, we're identifying many of these cervical abnormalities in the very early stages, where most of the treatment that occur in an office setting, and an operation is not often necessary. And that accounts for why the majority of cervical cancer that I see personally are the inoperable ones, or the advanced stages, primarily because those are the patients who don't get screened.
Patrick, in
I
terms
mean,
of,
as an adult doctor and a pediatrician, I often say this, that the prevention of cervical cancer begins at adolescence. Because in all sincerity, here in the United States, like Dr. Anderson alluded to, as compared to other, countries, developing countries, where the vaccine has been widely used. It'd be a shame for somebody to die from cervical cancer here in the United States, because it's one of the most preventable, cancers that we do have. And he did mention about, having kids aged for girls 8 years old and for boys 9 year old. And most people tend to concentrate only on girls and ensuring that the girls are vaccinated, but they tend to forget that the boys need to be vaccinated as well. And I tell mothers, like, you want to protect your child from cervical cancer in the future, you need to protect somebody else's child as well. So vaccinate your son, so that your daughter will be protected by somebody else's mother as well. So, but unfortunately, in our community, in the Black and Brown community, the information is still not out there as much as it should be. And I had a talk last week, and I brought up the issue of vaccination for HPV vaccination for kids, and the mother was shocked. Like, I wasn't told. I had no idea. Is it still possible for them to get vaccinated? Yes, you should still do it. It's a series shots, 1, 2 months, and 6 months, as it need be. And if you have a discussion with your pediatrician, as grandma, because my grandmothers as well tend to bring these kids to the hospital. If they don't ask questions, they'll never know. So again, like we always say, before you go for any medical visit, do your homework. Sit back, ask questions. What do I need to do for my visit today? What are the questions I need to ask? What are the things I expect from the doctor? And a lot of the time people have these thoughts in mind, and when they come to the doctor's office, they forget. So write them down so that you can sit in front of the doctor and ask those questions, and then they can answer those questions for you.
Excellent.
Yeah, and as Dr. Lewis says, the prevention begins with the adolescents, with vaccination, starting usually around age 8 to 9. However, adults can also be vaccinated. The recommendation is also up to age 45. And the age range has to do with the T cell response that you get with the series. So, and part of the education is it's a series. It's not just one shot. It's the three injections need to be completed.
Dr. Rogers, I was going to refer to you, but go ahead.
I just have a quick question for Dr. Anderson. If an unvaccinated positive HPV male is having intercourse with a vaccinated female, is the risk ameliorated? Is it mitigated, or is the risk still high because of regular sexual intercourse with a positive HPV male?
The vaccinated female is protected, but also bear in mind, vaccines prevent illnesses. It doesn't prevent you from being a carrier, right? And the female lower genital tract, unlike the male, is a receptacle. So having intercourse with an affected male and having multiple sex partner and frequent intercourse, that same vaccinated female can affect another unvaccinated male.
Excellent answer. Excellent. Dr. Rogers, and
Sorry, one more. Dr. Anderson, this is one thing that often comes, and I do get this questions often enough. And we're going back to my early days in medical school in Nigeria and all the other stuff. What is the relationship of those who are uncircumcised with the risk of cervical cancer in men and in women?
I don't think there's a direct cause.
Dr. Anderson, Dr. Anderson, can you
Yes.
repeat the question, because Dr. Aluya's voice went. Say the question again, so we'll know what the answer is related to.
Yeah, the question
what's the
is
question?
there an increased incidence of cervical cancer in sexual partners of uncircumcised male? Right,
Okay,
right, Nelson?
okay.
Correct.
Right. It's been implied, not proven. And it's the same thing, because now a foreskin can function as a receptacle. And based on folks' lifestyle and habits, one can easily be a carrier. And if poor hygiene is practiced, and an affected male, and you don't have to be uncircumcised, an unaffected male who gets infected today, who goes and have sexual relations with someone else, shortly thereafter, can potentially transmit body fluids from one person to the next. In theory, the direct cause of increases in cervical cancer in uncircumcised men, that has not been proven. Now, one could argue, and this is where we would need a Dr. Johnson, a urologist, to think about, is bear in mind that the HPV virus is the cause of penile cancers. And the question also becomes, is that the cause of or is there an increased risk of penile cancers in uncircumcised men compared to circumcised men? And I also don't think that has been shown.
Excellent, excellent. Well, we are out of time, but we're going to go over just a little bit, because Dr. Rogers, I have one more question, and it came from one of the listeners, Terry. It says, since we're talking about cancer, can pets detect cancer in their owners?
There have been some studies showing that the olfactory system of a dog is 10,000 to 50,000 to 100,000 times more sensitive than humans. So there have been studies, and it has been shown that certain types of cancer dogs can detect. I think melanoma is one of the examples that has been used, that dogs can detect melanoma in a human. And if they've been trained properly, they will alert on that type of problem. I'm not aware of other cancers that have been looked at, but certainly you can train a dog to sniff certain things. And if recently they talked about dogs identifying COVID, and I don't think that's possible. I don't know that the studies have been done, and certainly I haven't seen them. But dogs can be more highly sensitive to odors, and if the odor of a cancer or a neoplasm is unique, then a dog can be trained to identify it. That's not an easy thing to train a dog to do that. I know I've trained police dogs to find drugs, and they are very odoriferous and very easy to train. I'm not sure it's as easy for cancer.
All righty. Well, thank you, each and every one of you docs, for coming on and bestowing your knowledge. We've run out of time, and I'm going to end with my usual closing statements. Number one, thank OBHealthy for allowing us to use their platform. Remember, everyone out there, please download their free app. It is an app that deals with healthy eating, weight loss, and health and wellness. It has so much on there for you. Just use the coupon code 365, and it is free. Please download it. Second, this is our webinar is the second Saturday of each month, and please let everyone know it's at 1 o'clock Eastern time. All righty, caring and sharing. So if you've missed any of our webinars, you can see them on YouTube. Check them out, please. The most important thing that I can say that I said all day long is, please do not change any aspect of your medical care until you consult your physician, because only your physician can truly understand how to best treat you and your medical problems. I think that's all we have to say. And again, I said thank you to the audience for coming on and listening. Thank you to the physicians who've come on and bestowed their knowledge. Until next month, the second Saturday at 1 o'clock, I'm going to say peace to everyone. Be well. Thank you, everyone.
Thank you.
Thank you, Dr. Rogers, for coming on.
All right. Thank you, Dr. Rogers. Yeah.
Thank you. I
All
enjoyed
right.
it.